So when parents initially come in for services and they're filling out their intake form and I want them to describe the problem, 8 out of 10 will write, my main concern is that they're not talking. Once I get into the evaluation, I explain to them that we're not just going to be looking at the fact that their output is limited, that I need to check that their comprehension as well as their play skills are on target for where we would want for their age. There's a popular test that many speech therapists use, and it's called the preschool language scale. And it's often quite eye-opening for parents to see the whole list of skills that have to come in terms of comprehension before a child will really become verbal. And most children are not really talking much until about 18 months. It's after 18 months that language really explodes. Checking their receptive language is one of the areas that I heavily focus on with the little ones when they're coming in, and so that we can reinforce those foundation skills such as following simple directions. Does a child follow directions? So I want to see, can you go get the book, please? Please sit down. And then I will notice sometimes that those are weak skills, that the child is actually tuning me out, is not able to follow directions without a lot of cues and a lot of support. The other skill I want to look for is joint attention. Is the child able to focus on the same object that I am focusing on? Again, has an important precursor to communication is that we kind of both have to agree that we're going to be talking about the same thing. The other important skill that needs to come in is turn taking. Are they just on their own track? Are they waiting for you to respond to something that they do? Again, which is kind of conversational skills, but at the basic level. So learning to take turns, whether it's in play or with our voices, like with ba ba ba, the baby says and mama says ba ba ba, that back and forth, all these are the template for children learning to be interactive and conversational. Another really important skill that we work on is attention. Attention is really what Laura Mize, who you can look her up online, she has a series of fabulous podcasts. She talks about attention as being the gatekeeper for new learning, and it's so true. If a child is bouncing off the wall all the time and not engaging with toys, then they're missing a lot of learning opportunities. For example, they learn cause and effect. I take my finger, I push, something happens. I learn how to problem solve. If something, if I'm trying to put the piece in this way and it doesn't fit, I have to figure out another way to get it in. So the child who is very active and can't sit for more than 1 or 2 minutes or stay with a toy for more than 1 or 2 minutes, they're missing out on a lot of learning opportunities, and inevitably this can lead to delays in their speech and language.